legal challenge is to fight so that the Canadians who are not in jail have the same rights as those who are in jail.
My guest today is one of the most preeminent physicians in British Columbia and was a pioneer in arthroscopic surgery and sports medicine, even developing the world's first surgical robot. In addition to academic orthopedics, he has lectured and written on health policy and previously held the post of president at the Canadian Medical Association. Despite the deterioration of Canada's public health care, made even worse by the pandemic, Dr. Brian Day is optimistic that physicians can lead necessary reform and propose solutions that can get Canadian healthcare sustainable and functional once again.
Today, a special episode of Return to Reason, where knowledge and wisdom intersect.
Well, Doctor, it's great to have you with me today.
Great to be with you.
We're going to talk a little bit about our healthcare system. And a lot of people think everything's fine. They're not aware of flaws or issues until they need it. And then there's some real problems. Talk to me a little bit about how bad our healthcare system is, and maybe even compared to other countries. You're the expert on this.
Well, it's not just now that it's become rated badly. It's always been. So even going back to, the early part of this century, in the World Health Organization ranked Canada's health system 30th in the world. Many took some hope from the fact that the US was ranked even lower at 37. So, but now the most recent rankings, which come out, there's one from Europe, which ranked us compared to European countries 23rd. There's one from the Canadian Institute for Health Information and the Commonwealth Fund. Canadian Institute for Health Information, called CIHI, is a federally funded body. They ranked us 10th out of 10 alongside countries that offer universal health care. And coincidentally, we also ranked the highest in spending amongst those 10, and the last in equity amongst those 10, and the last in health outcomes amongst those 10. So there's something not right with our system.
Yeah. What are you noticing? You're a doctor, you're an orthopedic surgeon, you've been practicing for years in Canada. Just give me some examples for people who are listening. What is going on that you're seeing? Waiting lists, problems, issues, what are they?
Well, I would like to say this was happening way before COVID.
Yes.
We talk about the shortages of doctors and nurses. Well, it's no coincidence that in the early 1990s, the NDP governments of British Columbia and Ontario decided that having too many doctors and nurses was causing too much healthcare to be delivered. And so they cut back on medical schools and closed nursing schools and hospitals. Roy Romano, who operated was the chair of a 2002 Royal Commission when he was Premier of Saskatchewan, closed 52 hospitals. And now we're ranked 69th in doctors per population and 31st in hospital beds. And yet we have the most expensive system in the world. The underlying problem being that the government is not running the system well, and that they are to blame.
Now, in other countries, if they need surgery or anything like that, they get in fairly quickly. Is that correct? In some of the other better run systems?
Absolutely correct. That we had we can, if we compare ourselves to countries, social democracies like Sweden and Denmark and Germany and France, we are way behind in access. And as I said, the Stats Canada, what's interesting is the lower income groups in Canada and the most in need have the worst health outcomes and the worst access. Those statistics come from the government. So we are underperforming on a scale that's incredible. In Germany, for instance, where patients don't wait and never have waited the way Canadians have to wait, whether it be in the emergency department or for scheduled surgeries or for an MRI, or we are grossly underperforming and spending more than they do.
So Germany has no waits on any surgeries, and we have years.
Well, I wouldn't say they have no wait. So, for instance, one of the arguments raised in our constitutional challenge, and they actually quoted a study from Germany by the opposing bodies, was that in Germany they have a private system running alongside their public system, and this is terrible because the wait for they reference an article, the wait for a gastroscopy, which is where you put an instrument into the stomach, was double that in the public system, and the same with MRIs. But then when you went and delved into the data, the wait list for an MRI in the public system in Germany was double, but it was 2 weeks. And it was 1 week in the private system. And the gastroscopy in Canada, in BC, the wait was 12 months, but the double wait in Germany in the public system was 1 month. So this is how people distort the facts. If you just say, oh, it's kind of like saying it's inequitable because it's not equal, but the least equitable health system among 10 developed nations, according to the Canadian Institute for Health Information and the Commonwealth Fund, is Canada.
Wow. Well, what are the real human costs for wait lists? What is going on with people's lives? Are they on pain meds waiting for a surgery for months and months?
Worse than that, people are becoming drug addicted on narcotics as they wait in pain. Even in our trial, this was pre-COVID, in British Columbia alone, over 35,000 patients were waiting beyond government mandated maximum acceptable wait times, 35,000. But the crux, the key issue there is, at the same time, those 35,000 patients were denied the ability to care for their own health by law. And it's the only country. So I think this is something that Canadians don't know. There is only one country in the world where it's unlawful to obtain private health insurance for hospital and medical services, and that's Canada. Not in China, not in North Korea, not in Cuba, not in Vietnam. These communist countries have a dual system, and it keeps the public system honest. It's like any monopoly is bad for the user of the service that the monopoly provides, because they don't have any yardstick by which to be measured.
So doctors like you who are in the system, you're there every day working with people, you've got answers, but the government is not listening. Is that correct?
Well, my approach, to explain it as an analogy, if supposing there was a league, if you were a soccer fan or a hockey fan, and your team was 10th in the league, which we are in developed nations in healthcare, bottom, wouldn't you look at what the top couple of teams are doing differently, especially when you're spending more on your team than any of the other players? And the problem in Canada is that we have a government-only system that doesn't do that. And what I'm alluding to, of course, is that every one of the other performing systems has a small element of non-government competition, and that forces accountability, because the public can then see that there is a yardstick by which and the reason they don't like private facilities like the one we have in British Columbia is that we make them look bad. Whereas if you don't exist and it's the only option, then a 2-year wait to get a surgery seems fine. But getting back to what you were saying, a study came out of a group recently that showed 11,500 patients in Canada a year die on public wait lists. They die without being treated. In our recent case before the BC Appeal Court, the appeal court stated quite unequivocally that patients were suffering and dying on wait lists. And that was something that the Supreme Court of Canada ruled in the 2005 Chaoli case.
That's interesting because, like, if they're in control of everything, is there still a behind-the-scenes tiered system? Like, do politicians get in quicker? Do others get in quicker?
Yes. So our private clinic in Canby Surgery Center in Vancouver, so the defendant in our recent constitutional challenge, which is going to the Supreme Court of Canada, was the Office of the Attorney General of British Columbia as the official defendant. They've sent our clinic private patients, their staff. The BC Nurses Union was the instigator of our, they forced us into this legal challenge. They send us patients. The current NDP government, we have had, and I can't name them for privacy reasons, we have had 2 leaders of the NDP government treated at our clinic privately. The groups that opposed us as interveners in the court, Canadian Doctors for Medicare, 2 of their executives have been treated privately at our clinic. This is and many years ago, over 20 years ago, I wrote an article because it was happening then called a hypocritical oath. And this is hypocrisy. And it's kind of like the former Soviet Union, where if you're on the Central Party Commission, you didn't have the same problems of anything that the proletariat had.
So government won't let us fix the system to look after regular Canadians. They're waiting, for months and months for a 1-hour operation on drugs the entire time, dying, get addicted. But if one of the politicians needs surgery, they quickly know exactly what to do to get it in the nation.
Yes, well, federal employees are exempt from these rules. And among federal employees are included, federal members of parliament, senators, judges, prisoners. Federal prisoners are exempt. And, one of the things I often say is our legal challenge is to fight so that the Canadians who are not in jail have the same rights as those who are in jail.
We've got prisoners who are getting the surgery first. They're breaking laws, they're locked up, and they're getting into the surgery before a citizen who's contributing and working and paying taxes and a healthy part of society.
We've had federal prison authorities send us prisoners, long-term prisoners, because they need them back for the basketball team quickly, and they've been treated privately, yes.
Now, other countries are doing way better than us. And so you were talking about, I heard you in an interview talking about there are 12 areas of healthcare that someone wrote a book on. And we're nowhere in any of those areas doing very well.
No, but I think most significantly, we are rated last for low-income individuals, which is what the supporters seem to think is the strength of our system. We are rated last by objective criteria, and most, again, significantly, last in equity. We're the most inequitable of the 10 countries that CIHI and the Commonwealth Fund looked at for equity. This is what they're arguing is the reason why we don't allow any competition, why we maintain a monopoly. And I say to those people, name me one monopoly that serves the recipient of the service well. The answer is there is none.
So do you work in a public hospital and have your own clinics? How do you do that?
for many years, I worked at the Vancouver General Hospital and the UBC Hospital. I still have privileges there. But when I became president of the Canadian Medical Association, I stopped working at the public hospital because you have to do on-call. But I think it's important to point out that my specialty is orthopedic surgery, which also has the longest wait list in Canada. When I gave up my operating time, it was taken over by a new young orthopedic surgeon who was able to do the on-call. I was on the road. The point here is that there are over 200 young orthopedic surgeons in Canada who cannot get operating time in the public hospital because they are rationing access. So that's a big problem, that we have this paradox that long wait lists in orthopedics and other specialties, and yet we have a surplus of orthopedic surgeons, and it's because we built Canby Surgery Center in the mid-90s because my operating time at the public hospital would progressively cut from 22 hours a week down to 5 hours a week. And I had 450 patients waiting to get into hospital. And that's so what we are doing in Canada is driving doctors and nurses out of the system by rationing. In other areas like family medicine, we are, and my wife is a retired family physician, we are, because of the rationed resources, we are grossly underpaying them. Doctors are retiring early and leaving. Nurses the same way. There's a toxic environment in the public system caused by rationed resources. And for governments to claim that they do that, if you allow some private competition, it will draw nurses and doctors away. It's the exact opposite. They will retain doctors and nurses. So at our clinic, Canby, where we have about 100 doctors, 23 of them are young surgeons who would not be in Canada if it were not for the fact that we've retained them here. And private facilities in British Columbia treat 89,000 patients a year. Those patients would be placed in the public system if we didn't exist. In other words, the queues would get longer. The exact opposite of what opponents of freedom of competition claim.
So what I'm hearing you say is that we're not short of ORs to do the operations in. We've got the doctors as well who can operate in the ORs, but that doesn't matter. So, here's a question I have for you. If I need an orthopedic surgeon, and I go to a hospital, how can I bypass that to get to you?
Well, the only way legally now is and this is interesting. So on tomorrow, I'm operating on patients from Alberta and Manitoba and in our clinic who don't wait at all, because once you cross a provincial border, you have rights that the residents of that province don't have, and that is the right to access healthcare when you need it, and not when the government says you're going to get it. This, to me, this is the other group that are exempt are injured workers and veterans. The federally the workers' compensation patients across the country are exempt. So workers' compensation patients don't wait. They are covered by private insurance, and we say that's great, but why can't everyone have the same option?
That would probably be a whole lot cheaper than all the money that's being wasted on a system that's flawed.
Yeah. Well, the other thing too, of course, is Canada is unique among the OECD, developed countries, in funding our hospitals with an annual global budget, what it's called block funding. And what I say is blocked funding blocks access. That means that when you go to a public hospital in Canada, you are using up the hospital's revenue. So a big hospital might get $2 billion a year. Every patient that goes there is a block to act, is a cost. So the chief financial officer does not want patients. What we need to do is copy other OECD countries where the public money even follows the patient. So that if you go for a hip replacement to a hospital in Alberta, in a public hospital, the hospital gets revenue from the public system. That changes the whole perception of how a hospital looks upon patients. That patients need to be looked upon as desirable entities, not as costs to the facility. And we are the only developed country that completely block funds our hospitals, and that could be done very quickly. The trouble is, it would end. The government has admitted that service is rationed. They have explicitly come out and admitted that they've got a limited amount of money. And what we argue is that the way to gain more access into the healthcare system is to allow, just as they do with dentistry and physiotherapy and medications and ambulances even, allow the private sector where it wants to fund those. So yes, keep a public universal system as they have in every other developed country, but don't keep it as a monopoly where there's nothing to compare it to for the consumer.
Wow, that is. So what can people do about this? Like, truthfully, when you talk about hospitals, I mean, going to a hospital isn't a fun thing to do, but if you're in pain and you're suffering, it should be. I rarely hear people say, man, it was a good experience in the hospital. And I've even heard doctors say that before COVID, it was a broken system that was maxed out. And then when we went into the COVID season, that they kept saying, well, it's taxing all of our systems. It was already taxed.
It was certainly. So the statistics on 35,000 patients in British Columbia waiting beyond the time that the government says they are at risk of a significant problem and even dying. That was before COVID. And there's this group out of McMaster that have estimated the wait times as a result of COVID will rise up to 7 times or more.
That's over 200,000 on the wait list, if they're right.
Yes, and we don't know how many are on the public wait list, because part of the rationing of doctors and nurses is that they can't get access to the second point of a wait list, which is seeing the specialist, because you need a referral in the public system to see a specialist. So there are multiple measures in place to allow rationed access to healthcare, and I think we just need to, getting back to the hockey and soccer analogy, why don't governments just look at countries that do better and learn from them? Why is there that resistance? Why do we cling to a system that everybody acknowledges is underperforming?
Why do we cling to it? What do you think?
In large part, it's a perception of fear that this system is somehow considered a founding feature of nationhood in Canada, which is false. You cannot have a system in which 11,500 Canadians die each year on a wait list and consider that a founding desirable feature of our nationhood. It's completely irrational. The biggest problem is the politicization. The politicians across the country are afraid of this because the public sector unions and similar groups have pounded them into believing that a monopoly is the best way. And yet even the public sector unions are now realizing their wages and salaries are going down. One of the advantages of allowing some private insurance and private facilities is that it will increase job opportunities and also increase wages at no cost to the taxpayer. When private facilities exist, unlike the public facilities, the taxpayer does not pay for the infrastructure development, it does not pay for the buildings, it does not pay for the operation. And if those facilities make what's called, the so-called the dirty word profit, guess what? The profits are taxed and it goes back into the public system.
Exactly.
Hospitals don't contribute to the public system funding in the way that hospitals do. And then the last thing I would say, there are over 2 million United States residents travel abroad every year for healthcare. We are their biggest trading partner. None of them come to Canada. In countries like England and Switzerland and Belgium and, dare I say, Cuba, they open their public hospitals to non-residents, allow them to be treated there, and generate revenue that they use to subsidize and improve the public system. This is called medical tourism. It's one of the biggest growing industries, a multi-billion-dollar industry. Our biggest trading partner, no Americans come to Canada because we have massive wait lists. So there are many ways to improve this system, but politicians, healthcare is called the third rail, the electrified rail. They're afraid of it. And they shouldn't be, because an Ipsos poll in 2018 showed that 76% of Canadians across Canada supported our constitutional challenge and allowing Canadians choice and allowing Canadians who are facing long wait lists to obtain private health insurance. 76% across the country.
We're in the last minute or so here. Are you guys in a lawsuit right now?
Yes. So we have lost our challenge. We basically went to court and said at the BC courts and said that patients are suffering and dying on wait lists. This is unconstitutional. Just to put it very simply, it was a violation of their rights to life, liberty, and security of the person. We lost at the lower Supreme Court, then it went to the BC Appeal Court, who granted us that patients were suffering and dying on wait lists. But they said, they actually came out and said that the law is grossly disproportionate and causing irreparable physical harm and increased risk to life. But they said that they didn't understand whether that might be harmful to the system overall. They said, we're not a health royal commission. We don't have the information to deal with it. Same thing happened in the Quebec case in 2005. And so we will have to go to the Supreme Court of Canada, where the Quebec refusal by the lower courts was overturned. And basically we're arguing that Canadians who live outside of Quebec should have the same legal rights that the Supreme Court of Canada gave to the residents of Quebec.
So where can we follow you and what's going on or get more information on this?
Well, I'm on Twitter at Dr. Brian Day. And I think that as this goes to the Supreme Court of Canada, it's going to be in the news. But I mean, I think anyone listening to the news daily now knows this health system is in a crisis. Everyone admits that. Let's look at systems that are not in a crisis and learn from them.
Dr. Day, thank you for being with us. This has been eye-opening, coming from an orthopedic surgeon looking at our system. Thank you so much for being on. We're going to have to talk again.
Thank you.
Thanks for watching Return to Reason. I'd like to read your thoughts in the comments section below and pay it forward. Share this video with someone. Hit subscribe and tap the bell icon so that you're notified every time I post a new video.